Hello everyone, I am urologist Omar Erdamakaya. The topic we will talk about today is how much we can increase our testosterone by dieting or avoiding harmful foods. There is a recent study on this in Italy. They recommended a low-carbohydrate Mediterranean diet to patients. What are the common characteristics of these patients? They suffer from infertility, they are between 35 to 40 years old, they are not obese, they do not smoke and they eat a Western-style diet. In this study, they just wanted to see how much they could increase their testosterone by changing their diet. The reason why I've taken this study in particular is that a lot of people ask which plant extract they should take, which one will increase their testosterone. There were already a lot of publications about this. For example, last time we talked about ashwagandha. Ashwagandha gave a 10 to 15% increase in testosterone. So if we do a low-carb Mediterranean diet, what percentage increase in testosterone? This is a study about this. Let's briefly explain what was done in the study. In the study, they completely changed the diets of the patients. Because these people eat a Western-style diet. What did they do? What changes did they make? First of all, they directed 80% of their food consumption towards organic consumption. And when they eat grains, they recommend whole grains. They recommended the intake of low glycemic index foods. Apart from that, they recommended eggs for breakfast. They recommended salmon, nuts, red fruits and oats as an option for breakfast. They've removed dairy products with the exception of goat cheese. They allowed yogurt and kefir because they are fermented foods. They recommended daily consumption of red fruit. They recommended at least 3 servings of green leafy vegetables daily. I also recommend this because green leafy vegetables are very important and very valuable in terms of folic acid. They recommended daily consumption of 30 g of hazelnuts. You can also consume raw hazelnuts, almonds and walnuts. Again, due to antioxidants and flavonoids. They recommended legume consumption 3 or 4 times a week, radish consumption 4 or 5 times a week. They recommended oily fish, salmon and derivative fish 2 or 3 times a week. They also recommended natural seaweed 5 or 6 times a week, but that is not available in Turkey. They have eliminated processed meat products because processed meat products contain nitrate. We made a video about this before. The nitrate rate is also unpredictable, sometimes it is high. This causes testicular damage and lowers testosterone. For this reason, it was completely removed from the diet. They recommend eating organic meat from grass-fed animals 3 to 4 times a week. What is the reason for this? Because if it is fed organically, the animal cannot accumulate the agricultural residues in its body that it would get in ready-made feed. Many people are very obsessed about this. So if the animal is fed with ready-made feed, both the B12 level is low and many agricultural residues remain in the meat and you consume that meat. They recommended a strong avoidance of packaged products. They limit fruit consumption to 300 grams per day. Why don't they want it to be more? Because fruits also have a high glycemic index. They also recommended frequent use of spices such as ginger, turmeric, coriander, rosemary, basil, garlic, onion and parsley. And the most important part of the diet is that they asked the participants to keep the portion of total dietary calories coming from carbohydrates between 35 and 45%. So they limited carbohydrates. So what happened after 3 months? After 3 months, the testosterone levels doubled. As you can see here, while testosterone was around 300 to 350, after 3 months the testosterone level rises above 700. Very good. I have never seen these rates in any herbal extract, friends. In addition, there is a parameter called DNA fragmentation index. This is one of the most important parameters for sperm to fertilize the egg. Because environmental toxins cause DNA damage, cell membrane damage, mitochondrial damage in sperms and impair the fertilization capacity of sperm even if the shape of the sperm remains the same. They detected a very nice decrease in this DNA fragmentation index after 3 months. If the person is obese, has a habit of smoking, tobacco, alcohol and lives a sedentary life, by correcting these, he can provide a strong improvement in sperm quality and an even stronger improvement in testosterone levels. If you do the Mediterranean diet in this way, you are getting antioxidants. You also reduce the effect of hormones such as insulin, glucose and leptin in the carbohydrate system on sex hormones. It is possible to say that while your testosterone improves strongly, your fertilization capacity also increases. In fact, instead of looking for miracles in rare herbal extracts, it is easier to find them in plants that are sold in the market. But it is always beneficial to consume organic ones. I like this publication very much because it clearly shows the increase in testosterone. The problematic part of the publication is that of course it was applied to very few people, 50 people. It is very difficult to do such studies on a large scale. Even if 50 people, I think it is a good study. Thank you for listening, best regards.